Hello, this is Win Hong. Today I'm going to demonstrate um, the pre-collection, the collection, and the post-collection of the patient blood. So I have my my gloves on, and I'm going to address the patient. Hello, I'm going to be your phlebotomist today. Can you spell me your first and last name? Can you tell me your date of birth? And the last one is, I want to ask her or him if he can provide any form of photo ID, so that I can confirm it with the information I have on the patient requisition. So after the patient identification process has been done, I will go ahead and ask a series of questions for pre-collection inquiry. I will ask, when was the last time you had anything to eat or drink except water? The second question, are you on any blood thinners like aspirin or warfarin, Coumadin? The third question is, where on your body was the last successful blood draw in the last one? Can you have you had any issues with blood drawing in the past? So after I get everything written down in record about the patient identification and venipuncture history, I'll go ahead and perform the venipuncture procedure. So I'm going to set up my supply in the following manner. The needle is going to be my dominant side, and anything beside the needle and needle holder is going to be on my non-dominant hand side. Okay, I'm going to perform vein selection on the patient's arm. Apply the tourniquet on, and we start to assess the medial part of the antecubital fossa, then move to the lateral part on which the cephalic vein lies. Okay, now I have identified a good portion here on the patient's cephalic vein. I will remember this vein configurations. Okay. Now moving the finger up and down, I can feel the vein's depth. By rubbing it, I can feel the veins size, the veins shape. Okay, I'm going to relieve it and apply alcohol back and forth at the intended venipuncture site. Exist. So while waiting for the alcohol to dry, I'm gonna set up my supply. I have my 2 tips collections in the order of draw, stuff, and my needle. So when the side has been dried, go ahead and perform the actual blood draw. I will retie the tourniquet, and I'm going to handle the needle. And I would like to remove the cap so that it won't disturb the material the material coat on the needle. So I want to hold it in a manner that better stable the needle. I will align myself to the direction of the vein, like it says here on the cephalic portion of the antecubital fossa, and I want to use my non-dominant hand to anchor this cephalic vein. I would anchor by pressing it down and move it a little bit outside so I have space to insert a needle. Okay, sorry, this way with the bevel up. Okay. Now I have a good vision of the aim that I'm trying to get my needle into. I'm going to maintain my eye on that aim. And now I want to slide my needle inside the vein with sweep motion. Now I'm going to insert the tube. Sorry, my arms got moved. And invert it for 4 times. I'm going to change another tube using counter pressure to stable the needle. Remove it also with counter pressure to stable the needle, and insert this orange tube for like 6 times. Okay. I'm going to use the 3rd tube here, and during the middle of the 3rd tube, I'll remove the tourniquet, and also just remove the 3rd tube with inversion. Now before I remove the needle, I want to hold the gauge in a manner that won't disturb the needle, and prepare for the pressure to be applied on the patient's venipuncture site. Remove it, and safety device activated. And I want to discard it in a sharp container. I would ask a patient to hold the gauge for 20-40 seconds while I am trying to fill the patient label with the patient's name, last name, date of birth, and my initials. After about 20 or 40 seconds, I would have to check what is going under this gauge for any size of hematoma or the irregularities in blood coagulations. Because after 20 to 40 seconds, the site is supposed to be clotted with a bead of blood. So I check and see if everything is in good condition. The blood has stopped, and then I will finish venipuncture by sealing the site with the medical tape. Oh, this is glumpy, but this is how you want it to be doing. This is so sorry. With the medical tape. Thank you.